Hello, welcome everybody to Juggling Lessons. This is number 3, I think, in our series on medical hesitancy. Today I am here with my guest, Daniel Strands. How do you say it?
Strandjord.
Stranjord. Thank
We
you.
pronounce it like it's an English word, but it's not.
Okay. Okay. So I maybe on another time I'd learn how this originally in which language, Danish or I'm not sure. Oh,
Norwegian, but close enough.
yeah, Norwegian. Cool. Uh, Okay, so I'd like to talk to you today about, well, I guess introduce yourself because you're you're a minor celebrity in my thinking. So I'd love to hear from where you are.
Well, my name is Dan Strandjord, and I am what we call an intactivist. I believe
Hmm.
that everybody, male, female, and intersex, should have
Hmm.
the right to make up their own minds about their own genitals. You don't cut children's genitals for cultural, traditional, or religious reasons of somebody else. If you want to cut your own genitals when you're an adult, that's your business. But in the meantime, you leave the children alone. And so, being that I'm American,
Hmm.
and we're the only country in the world still circumcising the majority of our baby boys without claiming religion as the reason for it, I have a
Hmm.
big problem with our medical system. And
Mm.
I know a lot of people who do not trust our medical establishment, including myself.
Hmm.
So I have quite a little history, and I'm happy to talk about it.
Thank you. Thank you. So, lack of trust. I find that's a key component in medical hesitancy. I think there are a number of different reasons,
Mhm.
and they kind of stack.
Yes, I
Um,
think
Go ahead.
one of my major concerns is that our medical establishment, our medical system, is
Hmm.
a for-profit business instead of a national
Yeah.
health like most of the rest of the world has.
Yeah.
Doctors get paid for everything they do. And
Hmm.
so they do things that aren't necessary.
Okay.
And these things have become established. And when somebody makes their living doing things, you have to wonder what their motivation is
Sure.
sometimes for actually
Yeah.
recommending and doing them.
Yeah. Yeah. I find for myself, I see that my goals and others' goals are often misaligned.
Yes.
And yeah, misaligned incentives, a bugaboo. And
Mhm.
I think by that measure, I have read that at least 25% of what's spent on medical is in stuff that's clearly misaligned from patient care.
Yes.
But
And we have so much
that's
paperwork involved in our system that at least 30% of our medical costs go to pushing
mhm.
paper instead of actual health
Yeah.
care.
Yeah, I think we're talking about kind of the similar thing, is that there's a lot of people doing administration, which is not well aligned with patient care. Yeah, paperwork, silly stuff. It Not that all of the I worked in IT. I understand the value of the data, but hmm. Anyway, sorry. Tell me, where do you stand on the medical hesitancy? I mean, from one side is, wow, I trust the doctors completely, and I'm really happy to go for elective surgery. To I won't let them touch me.
I'm uh, I'm very very close to I won't let them touch me.
Okay.
I need to be dying before I want to go to a
Yeah.
doctor.
Yeah. Yeah. That's
Uh, and that has
yeah.
that has actually happened to me basically. And I
Oh,
waited too long. Um,
okay.
so um, about I mean I really ought to explain my history of why I'm at
Mm-hmm.
that point.
Do tell me.
So I was sexually abused by doctors as a child.
Oh,
Not just the first time when I was a newborn and circumcised. That is sexual
okay.
abuse of a child. If you
Okay.
recall the rabbi in LA's film who admitted that it's abuse,
Yeah,
repeatedly
the
said
film,
it's abuse.
Cut. Sorry,
Slicing
Cut.
through the
Yes.
midst of circumcision.
Yeah.
It is abuse. And when it's done to someone's genitals, that makes it sexual abuse. Now, I did not know this growing up. I mean, I happened to be. But when I was 6, I was given my first hand job by a pediatrician. I have always looked like I am intact. That is not circumcised.
Okay.
I was the only boy with a foreskin when I was growing up.
Okay.
The only people who had foreskin were adults.
So you said appeared intact.
Yes.
And you did make mention of circumcision. So
yes. I had complications.
Okay.
And there is no dotted line around a little baby's penis with the words "cut here" written next to it.
Right.
So doctors cut whatever. And a typical circumcision done in the United States removes anywhere from 1/3 to 2/3 of the entire penile skin system, from the base of the penis body out to the tip of the foreskin. Anywhere
between
from
1 and 2/3 of the skin area.
Yes.
Okay.
Now, I have a lot of skin left, and I look like I'm intact.
Okay.
I did not know I had a glans penis. I did not know I had the head of my penis when I was 6 years old, until the doctor grabbed my penis and just yanked my foreskin back, which hurt like hell. Nothing was said to me.
Oh boy.
I got an erection,
Mm-hmm.
and he gave me a hand job, and I stood there laughing. I was totally, utterly humiliated,
Mm-hmm.
Mortified. I mean, I can't begin to describe how terrible.
Yeah.
And my father was there. My father was a physician himself. And they were both laughing. Nobody said a word to me about any of this. And eventually, while I'm getting my hand job, the pediatrician asked my father a question, which I did not understand. But my father's response was, yes, but the doctor didn't do a very good job of it.
Right. Okay.
So now I'm hearing that, I mean, I knew I was very different from all the other boys. I have 2 older brothers. I don't look like them. And my father was intact. I looked like him. I simply thought I had a grown-up penis. And but now I'm getting a hand job.
I get the association now. Yeah.
Yeah. I'm getting a hand job. And they're laughing. And I hear my father say, I knew they must be talking about my penis. I didn't understand the question, but I'm sure the question was, had I been circumcised? And my father's response was,
obvious.
Yes, but the doctor didn't do a very good job of it. I still had no clue what was going on. I simply knew now that I was different because the doctor did something to me and made a mess of it. And that just absolutely, totally, utterly destroyed much of my life hearing this. And so I do not trust doctors. I was sexually abused again when I was about 12. Again, the doctor was not thrilled about the way my penis was. And again, I was told absolutely nothing. I still didn't know I had been circumcised, because we don't talk about these things in the United States at all.
Right.
So I was absolutely, I mean, I felt terrible about myself. I thought I was defective. I thought, all sorts of horrible things about myself.
So whatever is good about the penis, you're going to miss out on, was the idea.
Well, I didn't know anything. I just knew I was defective in some way.
Okay.
And I wasn't like any of the other boys. I mean, I never saw another American-born boy with a foreskin until I was in college. And there were very, very few in college also.
Yeah.
So and there was no information in those days. This is
Right.
I was born in
It's
1952. So there was
a bunch of
no
secrecy, and you
information.
have to
Yes.
you have to get into the medical literature to even
Yeah.
understand any of it.
And so I don't like doctors. I mean,
Okay.
I'm absolutely petrified. My blood pressure goes through the ceiling when I'm at a doctor's office. My heart races. I almost didn't get a job once because in the pre-employment physical, my heart rate and blood pressure were just sky high. They're actually fine when I'm not.
Yeah, under normal conditions. Yeah. So medical anxiety.
Yes, I do not want
anxiety.
anything to do with the doctor. So,
yeah,
about 16 years ago now, I got an infection in my right leg.
Okay.
And I thought, okay, it'll go away.
Oh
but
boy,
it didn't go away. And I called my sister, who was a pediatrician, and she said, "You need to go to the hospital, and you need to go to the hospital now." I said, "No, I'm not going." And she said, "You have to go now." And I didn't go. The next morning, my whole leg was about twice its normal size and all red. I couldn't walk on it. When I got to the emergency room, I was immediately put into a room. I didn't have to wait.
Right. They went.
Yes. And I was put on IV antibiotics for a while. And then after a few days, I was sent home to do the IV antibiotics myself. They stuck a port in, and I did it myself. Now, we couldn't figure out, there was no obvious place where I'd been cut or anything. We didn't know how the infection had started.
Right.
And the conclusion was, well, nothing we can do. We've cleared up the infection finally. Just see what happens. Well, about a year later, I had another infection, starting in the same place in my right leg. And again, I was put in the hospital for a few days. And here we go.
Did they find out whether it was the same pathogen? I was assuming they took.
They did, and they couldn't find anything. They couldn't figure out what it was. They didn't know whether it was probably in the strep or the staph variety. They didn't know.
Okay.
And as my sister says, they weren't taking enough blood. They just take a tiny little bit of blood. They're not necessarily going to find some of this stuff. You need to take a big sample. Okay. And anyway, so in 3 years, I wound up having 6 infections.
Oh, wow. It dominated your life for that time.
Well,
you're constantly recovering.
Only when I was sick. Otherwise I was fine. Okay. And so after that first 3 years, we decided my right leg will. What we think is the issue is that some of the lymph nodes in my right leg are not working properly, so they're not draining the fluids in that leg. And so I started wearing a thigh-high compression stocking on my right leg. And I didn't have an infection for 5 years or almost 6 years.
Okay.
And then very beginning of 2015, I had another infection. Was back in the hospital. This time, again, they didn't.
Same leg?
Right leg? Same leg. Always starts in the right leg, in the same spot right by my knee, where there are some lymph nodes that are apparently the ones that aren't draining my leg properly.
Okay.
This time, after I recovered, we did some blood works and looked at some of the what are called S titers, and discovered that it must have been a strep infection.
Okay.
So
there's some progress.
Yes. So now I am not only wearing the compression stocking, I am taking penicillin twice a day.
Oh my.
Every day.
Okay.
plain penicillin, not the fancier versions, but
Okay.
just plain penicillin. Because there are studies that say that people with this, women who have breast cancer and have lymph nodes removed also have these kind of problems. Guys who have various other problems that injured their legs, their arms, and there are people. I'm not the only person wearing compression stockings and stuff. Yeah, I haven't had an infection now for 6.5 years. So apparently the penicillin is working, and the compression stocking. It doesn't affect my life, except that I'm wearing this stocking. I call it my sexy leg. Looks like a woman's on a stocking. My other leg is not sexy, but my right leg is sexy. And other than that, it doesn't do anything. It doesn't affect my life really. But
so, are you taking the penicillin orally or by injection?
Orally.
Okay.
And so, it's really not a big deal. But I really probably messed up my leg and the lymph nodes much more that first time by not going to the hospital when my sister said, you have to go immediately.
Right.
Because my leg was twice its normal size, and it really messed things up internally. So now I am susceptible to these things for the rest of my life. Okay. I almost died. Very close. And it was because I was too stubborn to go to the doctor.
Yeah.
I am still not the type who wants to go to the doctor. Now, I should say that after that last episode in the hospital 6.5 years ago, I was still in Chicago at the time. I sort of said, you need to get an infectious disease specialist to look at this and decide what to do. So I'm going through the list of infectious disease specialists at the hospital, and I'm ticking them off. Nope. This one. He went to medical school in Belgium, and he's got a French-sounding name. He's probably not circumcised. He probably understands that you don't cut little boys like American doctors think we should do.
Oh.
So
so you were looking for somebody from a culture where circumcision was less common. Okay.
Yes. And he was wonderful. But now I'm in Denver, so don't have that doctor anymore. But I am very, very particular about who I am going to see if I have to go to a doctor. And obviously, if it's an emergency, you got to take whatever you get at the emergency room. But otherwise, I want somebody who is medical establishment culture that's been taught all sorts of absolute nonsense about circumcision.
Right.
So that's my background on this. Now, I know other guys who will not go to doctors for the same reasons.
Okay.
Not that they were sexually abused, as a 6-year-old, but over the circumcision issue.
Not specifically about genital interactions, but for similar reasons.
I mean for
abuse, trauma, medical.
I mean simply over the circumcision issue. There are a lot of men who have a lot of problems and damage from their circumcision, and they blame the medical establishment, and they won't go to a doctor. I have a friend.
Wow.
I had a friend in Chicago who I believe his refusal to go to a doctor contributed to his death a couple of years ago, because he just it didn't matter. He was like me, I'm not going to the doctor. I'm not going to the doctor.
Right.
And I think it had a lot to do with not taking care of something that should have been taken care of. So I hear this all the time in discussion groups online. A lot of Americans don't have any faith in American doctors. And it's very difficult to separate the issue of genital cutting of children and other medical issues. Doctors can do incredible things. My sister's a pediatrician. She does bone marrow transplants on kids with cancer. And she's never done a circumcision. It had nothing to do with me. She figured that out before I ever said anything about circumcision.
Mm.
But she's extremely unusual for an American doctor to have refused to do a circumcision in her training. And so lots and lots of people don't trust our medical profession because for 150 years now, American doctors have been pushing circumcision.
Okay.
And there's no reason for doing it.
Yeah.
Even the American Academy of Pediatrics has never recommended it. Despite what Americans think, American Academy of Pediatrics has never recommended circumcising healthy little boys. And
I hear that. Go ahead.
And yet, you know, how can you trust a doctor who is so uneducated about normal anatomy? What else don't they know?
Yeah, I hear that. It seems like one of those. For you, it's a shibboleth. I mean a test for inclusion. You're going to exclude a doctor who supports circumcision.
Yeah.
And you're going to select for a doctor that pushes back against circumcision. I think.
If I have a choice in the matter.
Yeah, if you have a choice in the matter. So, yeah, it sort of puts you in the single issue voter category on this one,
yes.
Which is, at least in terms of doctors. Yeah.
Now, this is actually a problem because one of the things, and you've been talking about this with others, is the vaccine issue.
Oh yeah, formally during these, I'm supposed to ask your vaccine status.
Yeah, I am vaccinated.
Cool.
I believe in most vaccines. I do not take my guidance from American doctors. I take it from European doctors.
Okay.
European doctors recommend some of these vaccines on a different schedule, more spread out than American doctors do. I would trust the European doctors more.
I think I understand and trust that guidance.
Yeah. But I do believe in vaccines. I mean, I'm old enough to, remember that, polio was once a really big problem and stuff like that. And, but there, unfortunately, and this drives me crazy about the American intactivist movement, is people are mixing issues.
Oh.
Abortion is not related to the circumcision issue.
Vaccines
are not
pretty much agree.
Related. Vaccines are not related to the circumcision issue.
Vegetarian, only by bodily autonomy. That's the only thing they have in common.
Yeah. Vegetarian and vegan is not related to the circumcision issue. And yet we have divisions in the movement where people won't talk to people in another group over these differences. And it drives me crazy. There are unfortunately a growing number of parents who refuse to cut their children who are also refusing vaccinations. And one of the things they say is these doctors don't know what they're talking about. And they have a legitimate point. The doctors don't know what they're talking about on a lot of issues.
Yeah. It seems like we have this.
It's very difficult.
Yeah, it is. Some of the ways people add weight or take weight away from data and sources is by a disqualification method. If they can say to a source, I can disqualify you completely because you my pet thing. And I'm not saying you're wrong. I completely support your choice to limit your doctors to only those who push back against circumcision. I think it's a perfectly good shibboleth, and you're hardly limiting yourself in terms of the actual doctors available. Seems like there would be a lot of them. Seems like this is at least at 10%. There aren't enough of them. Agreed. So maybe you can even, put up an advertisement looking for a doctor who pushes back against circumcision because I don't trust the ones who push the circumcision. Doctors might raise their hand.
Yeah.
Yeah. Oh, yeah.
But this
Sorry,
is
I
a,
was,
this
I
is
was
a, this
coming to
is
a
a,
point and I forgot it. So please continue.
this is a very, very serious issue to me, that so
Mm-hmm.
many people are refusing this vaccination
Mm-hmm.
because they don't trust doctors. Now,
Yep.
let me be very, very blunt here.
Mm-hmm.
Anthony Fauci, I have no respect for him. I have no respect for Deborah Birx. Both of them have been pushing circumcision as a way to prevent HIV.
Oh. Oh. Mm.
Do you know what the difference is in HIV rates here in the United States between men who are circumcised and men who are intact?
I don't remember specifically. I think I saw this um, recently, and I don't remember that. But it seemed counter the obvious. It seemed
Well,
counterintuitive.
you may not have quite heard my question properly.
Oh,
What's the difference in the United States
yeah,
between
in the U.S.
HIV in the U.S. between are circumcised men more likely to have HIV, or are intact men more likely to have HIV?
Let's see. I guess that the circumcised men dominate the population doesn't make any difference in that question. It's proportion of those.
Mm-hmm.
And I'm guessing because it would seem counterintuitive that the circumcised men have higher HIV.
There's no difference.
There's no difference. That's just statistically insignificant. Okay, good to know.
There's no difference.
The data hath refuted Fauci.
Yeah.
Okay.
I mean, there's no difference in Canada, which used to circumcise. You know, the AIDS crisis has been going on for 40 years now.
Mm-hmm.
And when it began, there were still an awful lot of circumcised Canadian men. Same thing in Britain, Australia, and New Zealand. None of those countries are circumcising now. But none of those countries had a difference in HIV rates.
Okay.
And yet
so
somehow
countries that are dominating circumcision and dominating away from circumcision, in both cases, no difference in HIV rates.
There's no difference.
Okay.
And I mean, if there was a difference, you would know that because you would be hearing it on the news every single day in this country. All these people trying to stop circumcision. You know, look at, there is no difference.
Right. Okay.
So Fauci has been pushing circumcision as a means to help prevent HIV. And as a matter of fact, Fauci came and gave a talk at the University of Chicago about 7 years ago when I was still there on HIV. And I went, and in his talk, he said, and I'll tell you later, I promise I'll tell you later here in this talk, but I want to do some other things. But I will tell you later how circumcision helps prevent HIV transmission. So I sat there waiting. He never said anything. So afterwards at the reception, I went up to him and I said, excuse me, but you promised to tell us.
Right.
And he refused to tell me.
Oh, okay.
Now, Dr. Deborah Birx, both Fauci and Deborah Birx are political animals. They do things on politics, not on the science. Especially Birx. I mean, you know, we're sitting there with Trump all that time. Was really an example of letting the politics override everything. And but anyway, Birx was in charge of PEPFAR, the President's Emergency Program for AIDS Relief.
Okay.
And they've been funding circumcisions in Africa. Well, PEPFAR finally, last year, beginning of 2020, has stopped funding circumcisions for people under the age of 16.
Progress.
Because of all the problems. But Birx hasn't apologized for all this stuff. She won't claim. She won't admit that this was a mistake. This was a disaster. And yet it was a disaster. And they finally admitted it unofficially by saying, we won't do this anymore because of all the problems we've caused.
Right. Right.
And so I have no respect for Fauci or Birx. They don't
Okay.
follow them. So I don't care what Fauci says about the vaccine. I care what Europe says about the vaccines.
Yeah. Yeah. And
Now,
that's enough.
And all-
European medicine is good enough.
and also my sister. My sister
Hmm.
is extremely knowledgeable about infectious diseases and the immune
Hmm.
system because her job in doing bone marrow transplants is to destroy the person's immune system and give them a new one with the transplant. So she understands how all this stuff works.
Yeah.
And when the COVID pandemic began, all the major medical journals made all of the studies they were publishing on COVID free and available to anyone. You
Okay.
didn't have
Good.
to subscribe to the journal. So my sister was following this stuff as it was happening, as they were being published, reading the articles, seeing what made sense, what didn't. And I trust her judgment on this.
Hmm.
I mean, I can't read those articles and make any sense out of them, but she can.
Hmm.
And so when she says we're taking either Pfizer or Moderna,
Moderna. Hmm.
those are good things.
Hmm.
Then I trust that.
Mhm.
But I don't trust it out of Fauci's mouth or Birx's mouth.
Okay.
That's just the way I am.
They've disqualified themselves.
They have such a poor history, and will not go back and admit their mistakes.
Hmm.
Which, by the way, the rest of the world has never thought that circumcision was going to stop the AIDS crisis in Africa.
Right. Right.
This was a United States push.
See, it's an almost entirely American idea. Yeah.
Yes. Mm-hmm. We're the ones paying for it. America is paying for it. And the European doctors say, the European doctors and many American doctors who have criticized those studies that were done in Africa in the early mid 2000s, saying the methodology here is lousy. It doesn't show anything. And we keep hearing, 60% reduction in HIV if you're circumcised in Africa. Well, it was not 60% reduction, it was relative. So you had, instead of 60% of the intact guys getting HIV, and only maybe 40% of the circumcised guys. No, it was a relative risk. So if 3% of the population during the study got HIV, it's not like it was millions more of the, you have to talk about the number needed to treat.
Okay.
And in those studies, there are lots of flaws that have been pointed out, but the biggest flaw was that the men who were circumcised were treated very differently than the men who weren't. The men who were circumcised were told, you need to use a condom.
Okay. So they got additional training that impacted them. Yeah.
Yes.
Okay.
The circumcised men saw the doctors at least twice, 2 extra visits, the overwhelming majority, 3 extra visits. And in these extra visits, they were told, you have to use a condom. The intact men, the men who weren't circumcised, were told, go fuck. And then they're surprised that, after a year and a half or so, there are more cases of HIV in the intact men there who were not told, you need to use a condom. And so Europe has never gone with this. Europe has lower rates of HIV than we do, and they're not circumcised. They've never believed this stuff. It's just American stuff. And when Fauci and Birx and all these people working for them promote circumcision, it's going to stop HIV. Haven't done a damn thing here. Haven't done a damn thing in most of the world. Most of the countries in Africa where we do have numbers, and I admit the numbers in Africa are not very reliable.
Okay. Yeah.
But in the overwhelming majority of countries that we're supposedly following, it's the circumcised guys who are more likely to have HIV.
Okay.
So where's this benefit? So I have a big problem with understanding, and so do a lot of other Americans who are concerned about the circumcision issue. They say, why would we trust any of these people on anything?
Right. So I want to ask your second best now. Full disclosure, I've known Daniel for a few months now, and we are very much politically aligned. I am certainly an intactivist, not nearly the activist that Daniel is, but it is my unabashed opinion that parents have no right to plastic surgerize their kids without their consent. And if they can't give their consent till later, well, then you have to wait. But that's where I stand. Sorry, there was going to be a question. Yes. So what would be your second criteria or second fear or second reason? Do you have a second reason besides circumcision that doctor fear comes up, or unwillingness to engage with medicine?
Well, I'm lucky that I have a sister who's a doctor. So she can deal with almost everything that comes up.
Okay.
And only if I have to go to a specialist do I have to try and get over this fear. Now, having had 8 life-threatening infections in the last 16 years, I have gotten over a lot of the fear that, I just absolutely can't go to the hospital or can't go see a doctor.
Right.
But I'm still very hesitant about these things. I've never had a problem going to the dentist.
Interesting.
I don't like going to the dentist, but I've never had a fear of going to the dentist. I don't have a problem going to the eye doctor. These are people who aren't going to grab my dick and start abusing me. Now, I should point out that if a doctor gave me a hand job now, I'd probably thank them, but that's a different issue.
Well, you're an adult. Sex means different things now.
Yes.
Yeah.
So, but I don't go to a doctor for a physical. My sister takes my blood pressure and stuff occasionally. I have had my cholesterol is fine. My blood pressure is fine. My blood sugar is fine, which is amazing because there's a lot of diabetes in my family. I'm
getting used to that.
Yeah. But I'm not going to a doctor for a physical. Just not going to happen.
Interesting.
And
do you fear that they might misdiagnose you and do an intervention that wasn't called for?
I wouldn't do something now unless my sister said go ahead and do it.
Okay.
Now, I mean, obviously, if I'm in a car accident, I have to take whatever happens in the emergency room. But if it's not something that is immediate emergency, I'm going to ask my sister's opinion on it. Yeah. And my sister is very, very knowledgeable about a lot of things. And if she's not knowledgeable about something, she knows how to look it up and read appropriate stuff, weigh all the evidence, and then come up with, well, this is what I'm reading. This is how I'm seeing. And she knows people she can call too. Because when you're dealing with children with cancer, you have to deal with all sorts of specialties in the hospital. You don't treat children with cancer out of your own little private office on a street corner. Okay. You're in a big hospital with all the specialties, because these kids, the chemotherapy and radiation can affect all sorts of body parts and stuff. You have to have consultations with all the specialties. So my sister knows people that she would trust their opinion on and say, if somebody came with this, what do you think? And then I would let her weigh the evidence, and what she
Yeah.
would say would have a huge influence on what I would do.
Indeed. Indeed.
Now, I'm if I was to do elective surgery, I'd probably
Mm-hmm.
go to Europe for it,
Okay.
or Australia, or New Zealand.
Okay.
But I just don't want to. I'm not comfortable in an American medical setting.
Okay.
But I
Wow.
live here, so I have to deal with it occasionally.
Yeah.
But
Yeah.
I still have, you know, when I had to get a physical for a job or something like that, and I
Yeah.
knew that was coming up, I would be a basket case for days ahead of time.
Wow.
And I mean, I have severe post-traumatic stress syndrome, I guess, is what
Mm-hmm.
we would call it now. But
Yeah.
I don't deal well with that. I absolutely panic. And like I say, my heart rate goes sky high. My
Mm-hmm.
blood pressure goes sky high. I'm shaking. Um, and this is from being sexually abused as a child.
Mm-hmm.
I didn't go into the details of the third time when I was about 12. But
Okay.
I mean, it just, I don't deal well with it. And I'm not trying to say, oh, I'm the worst. I've been sexually abused worse than others. Heavens no. But it doesn't take much abuse to trigger psychological issues.
Mm-hmm.
Nobody penetrated my ass. Nobody
Mm-hmm.
made me suck their dick or
Mm-hmm.
anything like that. Nothing. Nothing. Wasn't beaten and raped and all that
Mm-hmm.
kind of stuff. And a lot of people that's happened to them.
Mm-hmm.
I don't know how they deal with it, to be honest with you. But we all are affected by some of these things differently. And I guess it
Mm-hmm.
depends upon the values you were sort of taught as a little child. This was something private. You don't talk about it. You
Mm-hmm.
don't never discussed with me. My
Right.
father was a doctor, and he never explained to me what had happened.
Mm-hmm. Hmm.
So, I mean, I
Weird.
didn't like him either.
Ah. Do
So,
you think there's any connection with your father being a doctor and you coming to distrust doctors? When you're telling me the circumcision and the sexual abuse is almost all of it.
mhm. Yeah,
And
yeah,
I'm not wanting to diminish that at all.
yeah. I mean, it's something that psychologically I have a hell of a difficult time trying to get over.
Okay.
But I am at an
Uh,
age when things are not working the way they used to. I have
right,
to go
sure.
to see doctors. I mean, um,
Yeah. They keep putting a snooze alarm on mortality.
I don't quite understand that snoozle on the
A
mortality.
snooze alarm, like on your
Oh,
you can't make the alarm stop going off, but they can keep hitting the snooze alarm and giving you another
yeah.
go round.
Okay, yeah. So, I mean, I'm not 20 years old anymore.
Mm-hmm.
So things aren't what they used to be. I
Right.
got old people feet. I got old people hair. I got old people fat ass. I got old people fat
Mm-hmm.
belly. I got old people everything. I
Mm-hmm.
got old people's skin. I've got enough sun damage on my skin. I've been to the dermatologist a number of
Mm-hmm.
times. So, I mean, I do have to deal with doctors sometimes,
Mm-hmm.
but it's not something that I want to do, and it's not, and I'm going to be very particular
Mm-hmm.
about. I'm not the type. I'm not going to go looking for trouble.
Right. I hear you.
If trouble finds me, well, then I have to deal with it. But I'm not going to go
Yeah.
looking for trouble because I'm still so uncomfortable.
Yeah.
And like I said, this is a huge problem, I think, in our country
Mm-hmm.
because we don't trust our medical system. When Britain started their national health in 1948,
Mm-hmm.
doctors were no longer paid for each thing they did. They stopped recommending circumcision. They weren't given any extra money to circumcise the baby. By the early 1960s, infant circumcision basically disappeared unless it was being done for religious reasons.
Okay.
Similar things happened when national health was introduced in Canada, Australia, and New Zealand. They stopped doing these things. New Zealand went from cutting 95% to 5%. Australia went from 85% to 10%, and the national health will not even allow a routine infant circumcision to be done in a hospital. That's a public hospital. In all but maybe one of the states in Australia, you cannot even have it done in the hospital. You have to take your kid to a private doctor if you want it done. And like I say, there have been a lot of immigrants from Muslim countries and refugees lately. So the rate is about 10% in Australia right now.
Okay.
But it went from 95 to 5% in New Zealand. And American doctors get paid.
Yeah.
The University of Chicago, a few years ago, the government required that all hospitals that get government money, like for Medicaid, Medicare, and stuff like that, they have to have publicly available, like on the internet, a price list.
Would you they have to show their charge master.
Yeah.
Good.
Now, the problem with this is the list price has nothing to do with the price anybody actually pays.
There's that problem too.
So would you care to guess how much the University of Chicago listed as the cost for routine infant circumcision just a couple of years ago?
I wouldn't know. I would. What, $1,000?
$5,494. Now,
okay,
it's quite often done in just a few minutes by a third-year medical student who's been taught nothing about the anatomy, development, or functions of the foreskin. They never get $5,494.
Right.
Medicaid in Illinois pays about $200. They will very happily take that $200. So then why do they list $5,494? Well, then they can claim that, oh, look at all this free medical care we're giving away. We're not making any profit. We're losing money. We're not a for-profit thing. It's all an accounting game because our system is, our way we pay for medical care in this country is so corrupt. So
I worked in IT and medical, can confirm.
Yeah. So it's just ridiculous.
It annoyed the shit out of me. When I left, I never went back for ethical reasons.
It's just, I mean, how can you trust a system where that's the way it works? As I said, I go to the dermatologist now. I've got, you can see some of it now I've got sun damage spots here.
Okay.
The doctor doesn't charge, for the visit. Every spot that gets frozen, I just got the bill. It was $170 some dollars for each one. Now, Medicare pays for it. I just got a bill. I might have to pay $76 total out of the whole thing. But I mean, when you have several spots frozen and stuff like that.
Sure.
Small spots. I have, let's see, 1, 2, 3, 4, 5.
Well, it's good when you catch them when they're small.
Yeah. And they weren't cancerous. They were the type of thing that can become cancerous.
Right.
Not necessarily will, but could. You don't pay $107 for have things frozen. You pay $170 some dollars for each one. They get paid for each thing they do. They have no incentive to cut the cost because that's how our system works. So how can you trust, even if they don't mean to be abusing you or abusing the system?
I trust them to follow the incentives that they are adopting and agreeing to. And and that is a big reason for my own hesitancy, as I understand enough of the system, and the red flags just go off for me really bad. And I'm hoping that this series actually moves me and moves my audience toward more openness to medicine. I recently had a similar kind of infection-y situation like you did, and pushed it way too long and took to way too high a risk on my life.
Mm-hmm. And we can do incredibly miraculous things in medicine these days.
Mm-hmm.
So why are we wasting so much on things that we shouldn't be doing?
Oh yeah, that's a complex answer. I could speak for a long time on it.
Yes, so can I.
Not gonna right now.
And I have. But yeah,
I'm going to keep it to myself. Not that I'm not going to share it in little squirts and things in this series. Thank you, Daniel.
You're welcome.
I just have a few, like, almost formal epistemology questions. So I have two pairs. The first one is, what kind of information could you learn hypothetically? Something you don't know now that would move you further away from medicine.
You mean being even more reluctant?
Yes. What could rationally move your reluctance to more reluctant?
I'm pretty far down there in reluctance.
Yeah.
Because like I said, I don't go looking for trouble. If trouble finds me, okay, I'll deal with it then.
Mm-hmm.
I'm not sure I've moved in my basic beliefs very far. I have moved when necessity strikes, but not until necessity strikes.
Well, and you've delegated a lot of that executive function to your sister,
right? Mm-hmm.
And that trust is going to save your life. It probably already has.
Probably has. Mm-hmm.
Yeah. Yeah. So how about the opposite of that hypothetical? What could move you to trust doctors more?
If they would finally admit, like the rest of the world has, if American doctors would finally admit that they have been made a horrible mistake. With the whole genital cutting thing, whether it's males, females, or intersex. We have a long history of cutting both boys and girls and intersex children in this country.
Okay.
If they would come out and say, you know, we have been, like everybody else, we have been culturally, religiously biased.
Mm-hmm.
And we have not been able to see through that and just look at the medical evidence. And we are now going to stop.
Mm-hmm.
You know, for example, the American Academy of Pediatrics issued their most recent policy on infant circumcision in 2012. Mm-hmm. It's no longer in effect. It expired. And they very intentionally did not renew it. They got so many complaints, not just from Americans like me, but from the presidents and medical associations in Europe. 21 presidents of medical associations in Europe signed a letter saying the American policy was just full of nonsense. They didn't believe a word of it, basically. And in 2016, 4 years after the American Academy of Pediatrics issued that, Dr. Andrew Friedman, who was the pediatric urologist on the committee that wrote it, admitted very publicly in a letter that was published in the journal Pediatrics from the American Academy of Pediatrics. He admitted that they had not told the truth in their policy statement from 2012, that they did not have the medical evidence for the claims they made. And Dr. Friedman admitted, again, he's admitted many, many times over the years, that he himself circumcised his own son on the kitchen table of his parents' home on the 8th day in a religious ritual because that was so important to him as a Jewish man. He admitted the bias.
Yeah.
And yet he still says, but, we still want parents to be able to do this to their children. So So in 2017, the policy was either had to be renewed or revised or it expired.
Right.
The American Academy of Pediatrics very intentionally let it expire. But have you heard that they no longer have a policy? No.
No.
They
No.
will
Only from you.
They will not say anything publicly. We have no idea what they're doing in private to maybe come up with a new policy, but it's been 4 years now since they dropped that other one. But they're not saying, okay, the reason we don't have a policy now is because the last one was so bad. And we acknowledge it was so bad that, how can I trust these people? How can anybody trust these people? So if a pediatrician tells a parent, your child should get this vaccine, this, why should you believe that pediatrician? If that pediatrician also wants you to circumcise your kid. This is a huge problem.
Right. I totally hear the disqualification. I have some questions from the audience. Diamond Discourse asks, where should Americans get medical advice if they don't have access to someone like your sister?
It's very difficult. If I didn't have my sister, you'd have to shop around for a doctor. Ask them how what they think about medical ethics and human rights and things like that, about the issues that are concerning to you. Almost every medical student is required to do a circumcision in their training.
Right.
It's part of the training. Even if they're never going to do another one after they get out of medical school.
Right.
And so, once you have done a circumcision, it's not going to be easy for you to go back and say, oh, yeah, I shouldn't have done that.
Right.
So even if you don't agree with it, you're just going to keep quiet for the most part.
I would think. Yeah, you're complicit.
Yeah.
If you found it to be ethically or morally reprehensible later, you have to convict yourself.
Yeah, and also, who wants a lawsuit?
Of course,
there's enough malpractice lawsuits.
Indeed.
That who wants to put a great big sue me sign on their back? So like I said, if I had to do something, if I thought I wanted to do something, and it wasn't a rush, like I said earlier, I would go to Europe or Australia or New Zealand. Not everybody can do that.
I've been very fortunate in this, that I have 3 intimates who are somewhat qualified that are on my consent to support team. So when I need to consent to something, my son, the paramedic, one of my wives, the medical coder, and my other wife, who talks to me really well, they come together and help me work through the shit so that I can consent. And then I've developed a good relationship with 3 of the doctors that treated me, specifically Dr. Chang, Dr. Lam, Dr. Ansari. And that's my answer to where I have to get my medical advice right now.
Yeah.
And I'm quite fortunate.
I wish I could give better advice as to who to see.
Yeah, I hear you. It's a conundrum.
Yeah.
I have big trust issues that are malformed, and I've managed to get some knowledgeable people to pass my maybe silly tests. So, does profit being paid for services automatically negate necessity?
Not necessarily, but it's subconsciously or consciously. It's hard for a physician to separate that. If your paycheck depends upon doing something for a patient and being able to bill for it.
Yes.
Yeah,
it's a question of incentives. And if the incentives are more toward what some call it cover your ass medicine, where you just do every possible test just to rule out
Exactly.
even the tiniest fraction of doubt about things, and
Yeah, there's a lot of
procedures
that.
like, oh, we did a full body scan and we found 8 things of precancer. Now ethically we have to go in.
Mhm.
It's
Yeah.
like, come on.
Now, I am a big believer in, if I don't need to do something,
Mm-hmm.
I'll try and let my body deal with it.
Mm.
But I have to be convinced. So, for example, uh, as I said, I take the penicillin every day.
Mm-hmm.
Well, I'm not having side effects that I can notice from this.
Nice.
Um, but there are lots of drugs. I know people who are on heart medications and
Mm-hmm.
all sorts of stuff, who have all sorts of side effects. And I'm sitting here like, what? There's something in medicine called number needed to treat, NNT. How many?
Number needed to treat.
Yeah. In other words,
Oh, you mean the number of incidences of a particular disease?
yeah. So, for example, when you
Okay.
see all these commercials on TV for all these medications, and they
Right.
say it can reduce your risk of this, blah 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 blah. Well,
Sure.
you're going to want to know what's called the number needed to treat. So, what that means is, let's say you give 50 people with this condition this medicine,
Okay.
but it only actually going to help one of them. So the
Oh.
number needed to treat is 1 out of 50. I'm not sure quite.
Ah. So
Do you
it might
want?
represent only 2% of people are actually helped.
Yeah, and
Okay.
but 20% of the people have a certain side effect that's kind of uncomfortable. Now,
Oh gosh.
do you
My
want to
goodness.
take that medicine if it may not be doing you any good, but it
Right.
has all these other side effects?
Right. Those are the kind of statistics I really need to know about things
Yes.
before I can make a good decision.
Yes.
Hence,
And
it's so hard for me to make a decision. The last time we did it, it took over 2 hours of statistical analysis before we could make the choice.
So, for example, going back to these heart medicines,
Mm-hmm.
just because there's a medicine out there that might help you does not necessarily mean you should be taking it.
Right. Yeah, might help is different than will help.
Yes, I'm more of the opinion that if the odds of it helping me are just so overwhelming that I can deal with the side effects, well then yes. I had a friend, one of my college friends. He passed away about 12 years ago now. He was diagnosed with bipolar disorder in his early 20s. And the last time I saw him, he was taking about 12 medications constantly. He was taking lithium for the depression, but then he was taking drugs to deal with the side effects of the lithium. And then he was taking drugs to deal with the side effects of these other medications to deal with the lithium. He was a zombie. He was a zombie. And, you can be over medicated. And I'm very worried about side effects of drugs. I'm not worried about the side effects of chocolate. I'll have so much chocolate, it's ridiculous. But I don't care what side effects there are to that. There are enough advantages to chocolate.
Oh, the benefits outweigh the side effects. Okay, yes. Gotcha.
But when it comes to a lot of these drugs, they do have side effects. And some of them are pretty nasty.
Yes.
And you have to be able to, for yourself, decide, is this side effect going to be worth the potential benefit? Because it might not actually help you. And there are actually a lot of drugs that, 50 people have to take it before one of them is actually helped.
Wow.
And so when a doctor, diagnoses you with something and wants to start you on some medication, because it might help, you have to really stop and think about that.
Yeah, I've had some very bad experiences with doctors where I've told them, for example, of particular medicines which I very much had very bad reactions to, and then they immediately try to put me on those meds. And nope, trust is broken now.
Yeah. Yeah. It's very, very difficult. And I think a lot of all those studies that I see say that people are more satisfied and have better health outcomes in Western Europe and Australia, New Zealand, where they have nationalized health and costs them a hell of a lot less. And
except cancer. Yeah.
And so, are we really doing our medical care properly? As
The numbers would say no.
Yeah.
Yeah.
And
we pay more for less good outcomes pretty much compared to almost all of the well-developed world.
And no matter how well-meaning a doctor might be, they are, they've been trained in a medical system that's for profit.
Sure.
And they're told, you cannot be a specialist in everything. You cannot know everything. You have to rely on, okay, the medical textbook says this. This study says this. And you may just have to go with that. And it may not be the right thing.
Yeah. It's
and at some
too many
point
layers.
You're going to have to, and our doctors,
Yeah, I think there are too many layers between the scientists and the clinicians. And really, I hope that AI solves a lot of the question. I think AI is probably pretty good at diagnosis and knowing everything of all specialties at once. I think that's possible, of course. And I'm talking about neural network kind of AI and a ridiculously large training set.
Yeah.
A training set with many billions of encounters. And I think that would outperform a regular doctor and specialist stack. I think.
It's, I'm
pretty optimistic about AI, though.
I'm old. I'm going to die soon enough anyway. I'm not as much worried about, I'm not worried about trying to live to be 100. I don't want to live to be 100. I don't want to die tomorrow necessarily, but I certainly don't want to be 100. I'm not going to live long enough to see the benefits of a real change. I think,
Yeah, I agree. But it's so glacial.
Yeah, and it takes so much to try and get people's minds to change and learn new information. They're just medical students are just taught, do this, do this, do this, do this, do this. And there isn't enough questioning of why you are doing this. And I know
how many years if they're still in paper? Are there any other industries that still operate in paper?
Well, nowadays medical records, the electronic medical records are garbage. My sister hates them. She's retired now, but for example, one of her favorite things that she complains about is she's got a 5-year-old boy, and the assistant comes up with a medical chart with information pre-populated into things. So one of the first things that pops up is patient does not have an intrauterine device implanted. This is a 5-year-old boy, and she's got to go through this medical record and try and undo all this crap that's sitting there. So we've got, electronic records, maybe yes, but
serious user interface problem.
Yeah, I was at a dermatologist earlier this year, which is why I now have those bills for $176 each. But the doctor had and this basically a secretary type person in there
Mm-hmm.
typing all the things into this tablet.
Mm-hmm.
So
Mm-hmm.
while the doctor, was talking, and the person was writing what they thought they were hearing, not necessarily what the doctor is actually thinking. Or so the doctor then has to go through those notes
Yep.
and before signing them and all that kind of crap. And that's what
Mm-hmm.
that's how doctors work these days.
Mm-hmm.
Somebody else is sitting there taking the notes because you can't bill the patient's insurance without.
Right. If it's not on the chart, it didn't
Yeah.
happen as far as.
And
Yeah.
so the doctors don't have time to do all these charts, and it's, especially to go through and take out the stuff that
Yep.
the 5-year-old boy does not have an intrauterine device implanted.
Wow. Yeah.
So, our medical system is still pretty screwed up.
Mm-hmm.
Will be for a long time. And, to be quite honest, sometimes I think we're going to blow our entire world up in the next year or two anyway. So maybe even the next 10 minutes now. But
yeah, I sure hope not.
I can't worry too much about it, some of these things. But I'm still very involved in trying to protect children.
Mm-hmm.
Because this is what affected me so much, my entire life.
Yeah, indeed. Soldier on, my friend. Support in your endeavors.
Thank you.
And so thank you very much for this conversation. I've enjoyed it a lot.
I did too.
Thank you, Daniel, for making this really human.
Too human, maybe.
That's okay. I'm willing to err to that side because I think there's so much noise in politics and blame and bashing on people on these topics about vaccines and masks and authoritarian.
Speaking of which, I live in a retirement community, supposedly an active 55 plus community. The average age here is 75, so it's not quite so active. But in my particular building,
a lot of good people taking up medicine, pushing that average up.
Yeah. There are about 2,400 units and 3,500 people living here. In my particular building, I've had 3 people with COVID in the last 2 weeks. All of them were vaccinated, but they're all in their mid 80s, so they have enough underlying conditions that when they do get a mild case of COVID, 2 of them wound up in the hospital for a little while, but they're back home now. But
good.
They weren't wearing their masks anymore.
Right.
I've been wearing my mask when I go out. This is not over, folks.
This is not over. Yeah.
And we've got to take a little responsibility for our own lives. But I want people to go out and get vaccinated, but I can't exactly force them. Fortunately, with the full approval now, companies.
One less reason to not reject it.
And some companies like Delta Airlines apparently they've announced that if you're not vaccinated, you have to pay $200 a month more for your health insurance. And stuff like that. And I think more of that will come along, which will get people, when you hit them in your pocket.
Yeah. It seems like a whole lot of people can't be motivated by their own safety or the safety of their grandma, but put a couple of $100 into it, and they're like, "Oh, okay, we give up.
Well,
or you're not going to let me go on vacation? Oh, well, okay, fine."
My sister is retired, but she has been volunteering at vaccination clinics here in Colorado. She went to one last, I think it was Saturday. No, it was Sunday. There were 7 people there working the thing. Only 6 people showed up to get vaccinated. And it was in a part of Colorado.
So a bit overstaffed.
It was in a part of Colorado with a very, very low vaccination rate. Most of Colorado is doing okay, but this was an area not. Only 6 people would come in and get a shot. So they were there for 5 or 6 hours. 6 people got shots, and there were 7 professionals there.
Wow. Mm. Yeah, a bit
A, f-
overstaffed.
a few months ago, when she was working some of these clinics, there'd be over 1,000 people coming in.
Mm-hmm.
And we're at a point now where we've got people who just will not.
Yeah, they're just up. They're up against it.
Yeah.
I think there's a wedge of those folks that can be convinced by simple incentives, and some that can be convinced by critical thinking or just slow down type 2 thinking about the thing. I'm not sure what it is. I'm obviously in favor of the vaccine. I want people to get vaccinated. I think vaccine hesitancy is going to cost us between 250,000 and 500,000 people in this country this year. I'm guessing.
Yeah.
So I really hope to make at least a little difference in that.
Mm-hmm. You can lead a horse to water, but you can't make him drink.
That's it. And I'm not going to get authoritarian on their ass, and I don't want somebody to have mandatory thises and that's, but in some cases, I'm certainly not going to fight against that in the case of you want to go travel, you want to go expose yourself to a bunch of other people.
Mm-hmm. Yeah.
Sometimes the social duty trumps it.
Yeah. There's a reason why we have speed limits and stop signs. If you're going to drive, you have to do it within certain parameters. If you're going to live in a community, you have to do things for everyone's safety.
Yeah.
And that's not about restricting your freedom to drive 120 miles an hour.
Yeah.
I mean,
in the case of a natural disaster or some sort of nasty attack, I think that there's a duty of almost every able-bodied person to be willing to take a little bit of risk in defense of the community. And that's not a contract that they sign. I think that's just how humans need to operate. I'm strongly motivated by things like public duty in this regard, regarding the vaccine. Anyway,
I'm more influenced by protecting myself.
That's fine, because they're both aligned.
Yes, they're both aligned. If everybody were to do it, it would help everybody out. But we're overpopulated anyway. So, did I say that?
You might have. That's okay. You're not completely wrong, but I don't want to. No, not gonna touch it. Thank you all. Thank you all for watching. Thank you all on the replay. Thank you, Daniel, for sharing your very human story, and maybe it moves some people.
Okay.
Bye-bye.
Bye.